Hi, my name is Madison Morris, and I'm a student of psychology at the University of Tennessee at Chattanooga. I am currently focusing my research on an issue for consideration. As of now, the Tennessee General Assembly House Bill 637 is deferred due to the coronavirus pandemic shutdown. I believe our focus has shifted, and at the moment we are facing some sort of change. We are realizing that we only have a limited supply of resources. We are having to adjust to different lifestyles. Some of us cannot get the things that we need. I believe that we should be directing our focus on our health and our safety. By doing so, we are going to have to embrace some changes and make the most out of what we have. Furthermore, I would like to discuss House Bill 637. This bill establishes a framework within which to authorize access to medical cannabis on a regulated basis for patients with qualifying medical conditions. It licenses and regulates the processes for cultivation, production, distribution, selling, transport, and acquiring cannabis for medical use and research. Tennessee at the moment recognizes marijuana as a Schedule 6 drug, meaning that it is not a part of Schedules 1 through 5 of the United States Drug Enforcement Agency. In 2009, the Department of Justice advised federal prosecutors to make usage of their time more efficient to manage bigger priorities in enforcement, with the main priority being the prosecution of significant traffickers of illegal drugs, including marijuana, and the distribution of illegal drug manufacturing and trafficking networks. They were told not to focus on individuals whose actions are in clear and unambiguous compliance with existing state laws providing for the medicinal use of marijuana. As of now, medical cannabis is considered as a Schedule 1 drug according to the federal government under the 1970 Controlled Substance Act. Any cultivation, processing, manufacturing, dispensing, sale, or use will constitute as a federal felony. Despite the fact marijuana is the most widely illicit drug used in the entire world, cannabis is an abundant material and it has many different uses. Public policies can be designed to mitigate the processes for marijuana. The broad purpose of the Tennessee Medical Cannabis Act is to increase low-cost public health options. Most importantly to me is to alleviate suffering and to develop agricultural business, progress cannabis research, and license and track medical cannabis from cultivation to the point of sale in the boundaries of Tennessee. Moreover, the Tennessee General Assembly recognizes that 2/3 of the population in the U.S. have access to medical marijuana, and that 33 of those states have legalized medical cannabis for medical conditions. They also recognize peer-reviewed medical studies publishing evidence supporting correlation between lower opioid use overdoses in states with medical marijuana programs. Dr. Crystal Lindahl, director of the University of Wisconsin-Madison Brain Imaging and Neuropsychology Laboratory, asks a series of questions in a brief podcast presented by the American Psychological Association. The first question we need to ask is the current policy working to reduce marijuana use? Dr. Lindahl looked at how repeated marijuana use affects the brains of teenagers. There are significant changes in verbal memory, the ability to control impulses, decision making, the ability to kind of hold information in mind and manipulate it, the ability to sustain your attention over time, and other things that are noticed is increased mood symptoms, including depression and anxiety, and also increased problems with sleep or insomnia. However, found by Neuroscience of Addiction Lab and the Amsterdam Brain and Cognition Center at the University of Amsterdam, they state that mental issues and disorders are in correlation with heavy usage of cannabis. The researchers found that abstinence from the substance improved overall well-being of users. The most significant information found in the study is that evidence supporting cognitive impairment does indeed improve over time without the use of cannabis. So the second question we would ask, is the current policy doing harm? arresting 100,000 adults for the possession of marijuana, which resulted in costly procedures, according to the Bureau of Justice of Statistics, seems like a misuse of time, money, and effort. People such as Dr. Carl Hart, a professor of neuroscience and psychology at Columbia University, um, he brought forth concerns of a very large racial bias. He found that African Americans are 4 times as likely to be arrested compared to Caucasians. Federally, Hispanics are more likely to get arrested with more severe punishments. Ultimately, there is an argument that current policy in prohibition is doing harm as far as racial discrimination, arrests, and as far as sentencing goes. Dr. Hart was the first tenured African American professor, and he is known for his drug research in abuse and addiction. So, the next question we ask, what are the alternatives? A lot of people have come out to support decriminalization. One of the strengths of that, it gets rid of criminal justice issues and the cost of putting people in prison. America has more people in prisons than any other country in the world. There are clearly issues that need to be addressed in considering the Medical Marijuana Act, such as how are they going to prevent youth use? How are they going to get it, as in the people who need treatment? How well are they going to fund prevention and treatment? And then there's things like how are you going to limit advertising? How are you going to limit potency? How are you going to make sure that the marijuana is clean and doesn't have other things like mold in it? If we change adult policy, we really need to make sure that we have all of the safeguards in place to protect use in teens. I want parents, teachers, and physicians to start taking marijuana seriously in the use of young people and really educate them that if they use regularly, they may be changing the structure of their brain and they may not reach their full potential. Ultimately, there are two sides to the argument. However, the strong points lie in how it will benefit society. The most important aspect to it all is simply education. So, with all that said, thank you for your consideration and for listening. I hope that the information presented shed light into the issue from a college student's perspective.